do that, he yells no, he pulls hair, he destroys their stuff. If he does that kind of stuff because he does not want their attention, then it's to escape or to avoid peer interaction. And in that case, again, we need to teach him. We're teaching him something different. We're not teaching him to get peers' attention or how to play with peers appropriately. What we're doing is slowly teaching him different ways of interacting with his peers in a positive manner. Rather than pulling hair, have him say, no, don't do that. Rather than screaming, we teach him to interact with his peers using different words. Okay, so it sounds very similar, but the function is different. In one case, it's attention. In another case, it's to escape the peers. And so you approach it slightly differently in each case in terms of what you're teaching the child. Okay? So in general, but still very critical strategies for managing behavior, first and foremost, you need to build a relationship. You create the instructional environment. So somehow, if kids know that we're having a difficult time with them or that we're frustrated with them, they know that. They sense it. We need to make sure that we're fun and that we're enjoying that child, and we need to figure out how we can best do that. One of the best ways to do that, I think, rather than putting our demands on the child, is to figure out what really motivates this child. What is the best thing for this child that helps him be engaged with us? And that I would say is a very important thing. It's vitally important for working with kids with autism, but I would also say it's important for whether we're working with kids with cerebral palsy or a global developmental delay, a mild language delay, delayed language, even typically developing children. One of the students asked me about that. Do these strategies work for typically developing children? And they do. So capitalize on the strengths, interests, and motivation, and consider the physical environment. So kind of a precursor to everything is that, are there rules? Are there rules that the child can understand that are developmentally appropriate so that he or she knows the expectations? So for example, if you're doing a therapy group, do you ever do therapy groups with children? You know, do the children know what the expectations are? It should be one of the first things that you talk about with the children. And they can even come up with the rules of the group. Hands to ourselves, or hands on the table, eyes on the teacher, or eyes on the speaker, whatever it might be, so that they know what the expectations are. That's kind of a number one thing, especially in a group. And then you can just, if it's a visual poster or something about the rules, a lot of times all it takes is pointing to the rule to help the child come back and be on task. So visual schedules and other supports for clarity. I was talking to another student too, and I was saying, sometimes if a child just seems to be having a difficult with transitions or being part of therapy, it may be because they don't understand what the expectations are. And so a visual schedule to say, we're going to do this first, and then this, and then this. It may even start out with a really preferred activity to get them engaged and with you, and maybe something a little bit easier, and then it moves to the hard thing that they really don't like, but they can do, and then it might be another preferred activity so that they know, okay, if I do this really hard thing, then at least I get to this fun thing at the end. And it's always good to end on something fun, so they want to come back. Also, choices are, I think choices are like fairy dust. If you give a child choices, they're much more likely to be engaged with you. And so it might even be a choice of where should we put these activities? what should come first, the game or reading a book, and they can decide. So you still have the power. You're developing the activities that need to address your goals, but the children are getting to choose what they do and when they do it. So choices are really almost like magic. How many of you give children choices in your therapy session? Good, excellent. Yeah, it's so important. Even the more choices, the better. So the ABCs, this is the one where here's the assessment, here's intervention strategies. So I use ABC for both assessment and intervention. They mean slightly different things. Antecedent for assessment is what happens before the behavior occurs. When you're assessing, you want to look at that. Intervention strategies, it's about what are learning supports that you can put in place, or interpersonal supports, how you interact to help the child engage or to prevent the interfering behavior. So B under assessment stands for what is the behavior. It's all about identifying the behavior of concern. For intervention, it's all about extinguishing the interfering behavior and possibly teaching a new skill. You don't want to try to extinguish an interfering behavior without teaching a new skill. And last C under assessment is how you're assessing how the behavior is reinforced. And over here, the consequence is there is a reinforcement. It may be a punishment. That may be the reactive strategy. There are some things that are considered punishment, but they're not punishment in I think the traditional sense of the term. It's not aversive punishment. That's not what I'm talking about. It means a consequence that will decrease the likelihood of that behavior, as opposed to reinforcement. You reinforce to increase the likelihood that that behavior will occur. Okay, so reinforcement is increasing the likelihood for the behavior. Punishment is decreasing the likelihood of the behavior, and we'll get to that. So some antecedent strategies. All along I've been talking about first determining the function of the behavior. Once we know or have a hypothesis about the function of the behavior, then we can determine what strategy we're using for intervention. So if the function of our behavior is escape a task, avoid a task, avoid a task demand or a request that somebody makes, which the task demand could include a transition. It could include something in therapy that you're asking the child to do. It could include, at home it could include a task like even brushing teeth or getting ready for bed. So in therapy, I would say two of the main antecedent strategies that you can use, that is what you can set up beforehand to prevent the behavior from occurring, is adjusting the task difficulty and increasing predictability. Okay, and I'll get to those a little bit more. Other ones that I already talked about are providing choices. If the child keeps trying to escape, try giving them more choices. Integrate preferences and interests. Make outcomes functional and meaningful. So can you make it so that the child understands or sees the impact of his communication? I was talking to a student over here that talked about working with a 4-year-old, I think it was, who was nonverbal, trying to help that child become verbal and teaching her words or consonant vowel words. But the child does not yet communicate. And she even described the mom as anticipating what the child needs. She'll feed her before the child indicates she wants to be fed. And so they very smart students, they said we need to get back to pre-linguistic. What is before words? It's pre-linguistic. What is one pre-linguistic strategy that children use to communicate? It's gestures, using gestures. And so if this child is having behavioral challenges and not making any progress with language, then revert it back one step more to pre-linguistic and teach gestures, because the child's not even using gestures yet. And then that can progress from there. So that, I think, is a really good example of making outcomes functional and meaningful and at a good developmental level for that child. Use behavioral momentum. This is what I was talking about to somebody, I can't see her right now, that was saying the child likes her outside of the therapy room, doesn't like coming into the therapy room, and then she has a hard time getting her to participate. So behavioral momentum, do something easy, the next thing is easy, the next thing is easy, then you can do the hard work of therapy. So it might start out in the waiting room doing something therapy-like, but it's easy for her and can gradually transitioning until you're doing what is making the biggest impact. I would say too that even though I'm saying easy, it may seem easy to us, but for the child, it may still be a lot of work and a task demand. So we're just trying to be at the level where the child can make progress and be successful, that it can't always be too hard. Here, modifying instructional delivery. So that's where, another part where we come in. We certainly up here make some decisions about how we'll present stuff, but right here it's modifying how we are. We're kind, we're funny, we're patient, we give examples, we take turns with, so for example, if the child is having a difficult time with something, we take turns, so we're continually modeling what we want the child to do. And we're even helping them somehow, as much as we can, so they're successful. Then we can gradually back off with the amount of support we're giving as the child starts to engage in the activity more and more. Any questions about any of those? So, adjusting task difficulty. Here are some examples. And I would say for speech language pathologists and what we do, some of the adjusting task difficulty and increasing predictability are two things that can make a huge impact on the child's behavior, on preventing the interfering behavior from occurring. So first, provide higher levels of prompting and scaffolding for success. So if you're not getting the child to respond the way you need to, then you really need to think about where am I at with my support, and or maybe even a step lower and say, like the pre-linguistic example, do I need to be expecting less to get the child to this next level? So providing higher levels of prompting and scaffolding. Do fewer items. So it might be a really difficult task, and remember the easy, easy, hard. Maybe that hard, you start with just getting the child to get 2 done, and then you're done. So you never get to the part where the child has a tantrum or throws toys at you or whatever. It's easy, easy, hard, 2 times, you're done. Maybe the next time it's hard with three items that you ask the child to do, and then you're done. So you're gradually increasing the child's tolerance with the difficult tasks, and he's learning without having that interfering behavior. Oh, so this one here, help the child understand the request. So it may not be that they're non-compliant, that they absolutely don't want to do what you want them to do. It may be that they don't understand the request. So giving visuals, for example, to show them what you want them to do. Or it might be using simpler language. If it's a task on the table, it might be having fewer items in view. It may be also that this will get to our next one, but it might be just having a routine so that helps them understand what to expect. Make tasks less complicated, fewer steps. Make the activity briefer. So whatever it might be, it kind of all relates to doing fewer items. You can shorten the activity, have fewer steps. Collaborate. You do part of it, and then the client does part of it. Your turn, my turn, so that you're both engaged. It's not just the child doing all the hard work. You're helping the child do the hard work. Even cleanup time, for example. Okay, let's clean up all our toys. Put all the toys in the basket. It may be you do one, child does one. So let's do it together. Let's clean up together. You can even use that to increase the child's understanding. You pick up the blue truck. I'll pick up the red truck. Now you pick up the yellow truck. I'll pick up the orange truck. So it can be taking turns. It's still learning, and you're reinforcing those skills with the child. Here's increasing predictability. So this is an example. This would be for a child who can read, that it just tells them what to expect during the day. But even within your 45-minute, 60-minute therapy time, you can have a schedule that says, first we're going to, like with preschoolers a lot, I sing a song. And songs are a great way to help the children learn new concepts, or learn to start making gestures, or learn to start singing parts of the song, filling in the blanks. You guys use songs? The songs are a lot of fun for young children to get them to be engaged. Whoever had that little pre-linguistic child, songs are another great strategy to do that. First they start gesturing with the songs, and then they're learning gestures through the songs, and that's part of the pre-linguistic development. So I digress a little bit. So the schedule might be starting with songs, and then it might be doing other things. It might be book reading. It might be motor activities. Some of you talked about doing more movement activities. So what are your different activities, and can you just picture them, put them in pictures for your nonverbal or non-reading children, put them in a chart like this to show what they're going to do. It could be on Velcro, it could be on a whiteboard, it could be anything like that helps them know and maybe even choose what they're going to do. It could be, too, if it's a whiteboard with a marker, that they get to cross out when something is done. That is really reinforcing for kids, either to erase it or to cross it out to show that it's done and you only have 3 things left to do. So increasing predictability helps the children know what to expect, and it also helps them understand, too, what you're asking them to do, and they can see how much is left to do. I talk here, too, about closed-ended tasks. So that's also telling the kids in advance how much they have to do. So if it's that child that, something is really hard, you tell them, we're just going to do 2. We did 1. Oh, 1 left. So they know exactly how much is left to do. We're going to just do 3. So just they see, it's concrete, how much it is that they have to do. It could be putting a puzzle together. We're going to do these 3 pieces, and the 3 pieces are right out there for them to see. Consistency. You need to be consistent. Once you establish the procedure, you need to consistently use the schedule, for example. You need to have consistent rules that you follow through on. And I'm talking about rules that are very appropriate to that child, to the developmental needs of the child and so on. Once you get the routine going, you need to try to be consistent. That's not to say you can't rethink what you're doing and asking yourself, is that too hard? Do I need to back off a little bit, fade my expectations, or scaffold more? Do I need to change what I'm doing? It's really important to always ask yourself that after every single session, or even during every single activity that you're doing. One strategy that I've used is when I'm trying to teach them something new that they might resist, new toys, for example, or a new activity, what the consistent thing is a surprise box. So it's just a cardboard box, and it has a yellow star on it. We sing a little song about we're going to open the surprise box, and it's, what's in there? So what's consistent is the surprise box. What changes is what's in the surprise box. So that's a way to keep consistency for the sake of the child, which makes them, the interfering behaviors decrease, but it lets you add new activities to the session. So, any questions right now about escape behaviors? Those, I gave you many examples, and I would say as SLPs and audiologists, that's one of our biggest challenges. One of the biggest reasons that kids misbehave in therapy is because they're trying to escape the hard stuff that we're asking them to do. So we need to, make it easier. That's the biggest thing. Make it predictable. Give choices. Another thing that they do, though, is that they want to obtain or maintain tangibles. So that would be an example of having a difficult time with transitions. That they're playing with something that they really prefer, and they don't want to give it up. So one important thing would be to warn the child that you're going to take the item away, or that he can do it for 2 more minutes, or he can take 2 more turns, whatever it is, but that the time is coming. Might be a clock that he sees the time run out, one of those clocks with where the red hand shows how much time is left. You have those? Don't know. But some way to visually indicate how much time is left. Use a transition activity. So a transition activity might be singing a song. It might be, that's what I do with a lot of the preschoolers, is that we're playing with the toy that they really like, and we say, okay, it's, warning, it's almost time to clean up, 1 minute, and then it's cleanup time. So you sing a cleanup song. Clean up, clean up. Anybody know that song? By Everybody, Everywhere, clean up, clean up. But whatever song might be familiar to you or to your kids, or just make something up. But have it be consistent. If you sing a cleanup song, have it be a consistent cleanup song. It might be a transition activity might be when you flick the lights on 2 times. It means the transition is happening. Or you might have a bell, something that means transition is happening. It might be, walk to the door and wait for the SLP when transition is happening. So just trying to have an activity that is kind of fun, like a song. It could be movement that's kind of fun. Who was I talking to about the child that had difficulty walking? Can it be a song or some type of fun activity that makes them more motivated to come to the therapy room? Another way to help with the transition is to tell the child what preferred activity is coming. So if they have trouble transitioning from the waiting room into the therapy room, what's their favorite activity? And it could be on that schedule board to say, we get to play with water when we go in there. And that might be enough to get the child to transition into the therapy room. Part of this too, the person that I was talking to, she has trouble walking, and so one antecedent might be, can you move the therapy room to be closer to the waiting room so it's not such an effort for her to get to the therapy room. So it might be things like that aren't necessarily on my list, but it's thinking about what makes this challenging for this child. So an antecedent strategy for attention, I better hurry this up, to obtain attention. It's thinking of ways that you can make adequate attention, adequate positive attention available to the child. So it might be sitting next to you. It might be maybe for some of the younger kids sitting in your lap. How can they get the attention that they need so that they don't have to act up? But I think this one doesn't occur so much in the speech therapy room. So kind of in closing, I have 6 minutes to show you about 20 slides. So with this, we've talked about the antecedents. So we can do a lot before or to prevent the challenging behavior. And that's what we need to think about, is what can we do to prevent that challenging behavior from occurring. If we need to teach a new behavior, then we can do that in conjunction with it. Some new behaviors might be, for example, asking for help rather than acting out, rather than, ripping up a paper. Might be able to reject, to give the child the opportunity to say no, I don't want to do that. To protest, to go away, to request attention, teacher, or your name, request a break. This is hard work, I need a break. So these are for some a little bit more advanced kids. They're not necessarily verbal though, but they have the skills to be requesting for things. It might be on a communication board, or it might be through gestures. And then, of course, these are new behaviors that we're able to get to more if we're preventing these behaviors from occurring. Lastly, there are reactive strategies that we do if a behavior occurs. I'm going to go through those really quickly, but I have a great website for you to use that will give you some other ideas. Oh, before, I talked a little bit about effectiveness and efficiency of behavior. So as you're thinking about what new behavior to teach, you need to think about your consistency of reinforcement of the old behavior and the new behavior. Because the more consistent you are, the more likely that you'll get the behavior change that you want. So you have to start with very consistent reinforcement. Every time it occurs, the behavior that you want, you reinforce it. Then you can start fading the behavior. You won't always have to give that type of reinforcement as the child learns new skills. The response effort, how difficult is it for the person to demonstrate that response? So the child that has a hard time walking, that's a big response effort. She's not communicating that's hard for her, but that might be a factor for her. And certainly that pre-linguistic child, not being able to do the language sounds, the speech sounds, then that's too difficult for her. So you need to think about stepping back and making it easier. Quality of reinforcement, it needs to be preferred, and it needs to be often enough so that it's worth the effort on the child's part. And the immediacy of reinforcement, we need to think about what are we reinforcing most quickly, the child's interfering behavior or the behavior that we want the child to produce. So here's a great website. This is Positive Behavior Intervention Support World.com, and it has a whole lot of stuff. I really encourage you to just try to support it or explore it. Tier 1 means, remember I said it's kind of things you can do for all kids to make intervention easier, to make life easier. And then Tier 2, whoops, did that wrong. Tier 2 needs a little bit more support. Tier 3 needs even more support. That's the most intensive support. So this is an example of the page for the home page. And you can, for example, click on disruptive. So you're interested in what to do with disruptive behavior. And disruptive behavior can include all the things that we've talked about, from throwing toys to spitting to rolling on the floor and so on. If you click disruptive, then this is what it will show you. The student may speak out of turn, blurt, make inappropriate humorous comments, be impulsive, over-socialize, find fault in everything others say. And so with that, then you can, does this describe the student? Yes or no? Let's say yes. Then that brings you to this page, and it shows you Tier 1 interventions. So what are some easy things that you can do that will prevent the behavior from occurring? Okay, so some really good ideas. Let's say we want to look at take a break. We want to teach the child to ask for a break. Then this is what it does. What you should do, when you should do it, and how to do it. It gives you step-by-step instructions for how to teach having the child learn to take a break. It's a great website. It's very thorough. So I think, unfortunately, I'm out of time. Here's, do I have like 5 seconds? To major reactive intervention, so it's decreasing the behavior. And it can be either reinforcement or punishment. I'm going to show you some examples of punishment. So differential reinforcement, positive reinforcement, token reinforcement. Are you all familiar with those strategies? So punishment is extinction. That's totally ignoring the behavior. You have to be consistent with ignoring the behavior if you want to change it. That's the example of inconsistent reinforcement can keep a behavior going. If you are inconsistently reinforcing the behavior and not putting it on full extinction by ignoring it 100% of the time, the behavior will keep showing its ugly face. Timeout. Response cost, overcorrection, and restraint. And I don't have time to talk about them, but they're all described. And I have a website here that you can also look at if you want to know more about that. Okay? So negative reinforcement, token reinforcement, extinction, timeout. Oh, and if you're given a task you don't want to do, just start crying. They'll send you straight to the thinking chair. It's like a vacation from work. So that's an example of reinforcing a behavior unintentionally. Okay? Overcorrection, disadvantages. Okay, so that's it. Sorry I had to rush through all that last bit. Do we have time for questions? So here's a microphone, I think, if anybody wants to ask questions. I know you guys are shy about it, but when I came down to talk to you, you had great questions. I'm going to come down.
Hi, ma'am. Actually, I just want to ask you one thing. Like, transition issues can be interfering behavior. Transition issues can be an interfering behavior in later, like in therapy settings.
Transition behaviors?
Can be an interfering behavior in later.
Later? What do you mean?
Like if we are not treating it properly,
yes.
It can be an interfering
behavior. It can be related to an interfering behavior. Yes.
So how can we rule out interfering behavior and transition behavior in the beginning?
Well, I think the transition, you mean whether it's I think an inappropriate or a bad transition can lead to interfering behavior. And so if in your observation of the child, the behavior occurs during transitions, then that tells you that it's related to a transition and probably related to either a task demand or wanting to maintain something, a tangible. Does that answer your question?
Yeah.
Okay, good. Thank you.
I have a question. My question is regarding how you actually go about using the extinction technique, especially in speech therapy.
Yeah. So let's say spitting, the example of spitting. So does the person that said spitting, do you want to say when spitting occurs?
Actually, during the therapy, if we start off with doing something, and if the child doesn't like or he doesn't want to continue with that thing,
Okay.
he will throw tantrums. As a part of the tantrum, he starts spitting.
Okay. Okay. So I'm sorry. Would you repeat your question?
How do you actually go about with the extinction technique, especially within the speech
Okay.
therapy?
So with that activity, you would first of all figure out why is the child spitting and throwing a tantrum. It's probably because the task is too hard, and so you do a number of things. You do a number of antecedent strategies to make the task not so hard. So let's just say you've given them choices. You give them easy, 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 hard strategy, and so on. You're using a lot of antecedent strategies. Maybe once in a while he still spits. If he spits, you just ignore it. Now, and you ignore it consistently. If he spits, you may need to wipe up the spit, and you just do it without being emotional and being, giving him any attention related to the spitting. If he, after all your antecedent strategies, so this gets fast, right? Because you need to do the antecedent strategies, teach the antecedent strategies. Secondly, teach a new behavior. So your new behavior is telling you when he wants to take a break. Would he be capable of that? No? Is a child quite impaired developmentally? Too low? But it could be, okay, so in this case it might be you recognizing when he needs to take a break, and you verbalize you want a break, and you could even have a card that says stop or something that indicates that he wants a break. So that would be the second part. So antecedent strategies, prevent it as much as you can. Second thing would be teaching a new skill. Third thing would be reacting to the spitting or the tantrum. And one of those things would be totally ignoring it. So you totally ignore it. Don't respond to it. If you have to do something to keep him safe, do you have to keep him safe during his tantrum?
Yes.
It gets quite...
Because he's a cochlear implantee, so
He's
we
in a
need
what?
to be. He underwent a cochlear implant and he's attending therapy.
Okay.
We need to be a little careful because he's only 2.5.
Oh, okay, okay. So there again, you have to also think developmental level. 2.5-year-olds do have tantrums, and and that's somewhat expected, as long as he doesn't harm himself or others. He does?
He does sometimes. He just he jumps from the chair and he purposefully falls into the ground.
Okay.
So that he makes sure that this is getting hit.
So again, you need to, when it's a matter of child safety, you can't totally ignore it, right? You have to pay attention to it. But you do it without emotion and without giving extra attention to it. So you might help him down, but you're not talking to him, you're not getting mad at him, you're not trying to console him, you're just doing it without attention.
What I do is I just ignore him and I start doing the activity with the mother.
Okay.
So at times he comes back,
Yeah. Okay.
but it doesn't work all the time.
Okay. Yeah. So I'd say first and foremost, especially with a 2.5-year-old, it's about preventing that behavior by simplifying the task, doing fewer of them, giving choices, making it predictable. Yeah.
Thank you.
Thank you. Anybody else?
Ma'am, how is PBS different from the traditional behavior modification and the applied behavior analysis? Is it any difference?
They're very related, and I would say if anything, positive behavior support grew out of behavior modification, same principles,
Yeah.
you know, extinction,
the same
reinforcement,
techniques, yeah.
all of that stuff. But positive behavior support, the idea is that it's the pyramid, that you have positive strategies that apply to everybody, and then as children need it, they may need more intensive intervention. So it's positive strategies for everyone, including typically developing kids. And as they need more intensive intervention, you may do a functional behavior assessment to look at the function. So those are probably two of the main differences. You're determining the function, and it's for everybody with the pyramid approach.
Ma'am, one question, ma'am. How do we deal with embarrassing behaviors? You know, sometimes we have children who do inappropriate things as cross the intimate space, like come too close, or not maintain the boundaries, or sometimes touching themselves in therapy. So how do we deal with those situations in therapy?
So is your question two-part? One is to determine what behaviors to address. I mean, and so you do have to prioritize. Sometimes children have multiple behaviors that you need to address. And I would say first start with the behaviors that put him at risk for safety reason, or somebody else at risk. But then the other ones are around socially appropriate, right? Is this a child with autism by any chance?
Children with autism, and especially children who are like around a little older kid, maybe
Yeah.
like 10 and above.
Yeah. So for the child that gets into your space, with kids with autism, we have to teach them very specifically what are some strategies about space, because they don't understand that. And so it's teaching them and maybe using visuals too to help them know what's in their bubble, and that there are different people that can get into somebody's bubble. So it's using visuals. It's all those good strategies we use with kids with autism. The visuals, making it concrete, teaching specific rules, but also helping them problem solve when it's appropriate or not appropriate. I don't know if he's capable of the problem solving part, but
It's more of a general question.
okay.
Because we've seen a lot of children having issues, like either they walk into the personal space and it's up to the parent or the therapist to,
Yeah.
put the boundary.
Right.
And then the other situation is where children, self-stimulate
Right.
during therapy. We are going on with a specific goal, and the therapy is full swing, and then you find the child is just blanked off, and he's doing something very inappropriate in public.
Okay. So with the touching himself, I mean, so that's a big thing. I often use the strategy, and of course you need to work with everybody on the team, that there are places that you can do that in private. And then with the other stuff, just you need to teach it concretely, and then increase the environments in which to practice it. So there are a lot of good social thinking books in the United States. I don't know if you can get them here, but it's actually a cognitive behavioral approach to teaching social skills. Have you heard of Michelle Garcia Winner, that name? She's amazing. I can send you the links if somebody will remind me to do that. The social skills strategies, and it's all about teaching concretely, but yet enough that they can problem solve. I can do it here, but I can't do it there. And it's constant reinforcement, because it takes a long time for them to realize what's the bubble. Okay, how well do I know you? How close can I get to you? But my mom I can get really close to.
Ma'am, I was just thinking in caregiving, that is in family caregiving, this inconsistent reinforcement, maintaining behavior, and the home environment has a very major influence,
Right.
and it's a major component. And that is where the efforts that we take in a professional setting is somewhat the effectiveness and the efficiency becomes lowered, like, you know.
Right, right. So that's, if anybody who's a parent knows that consistent reinforcement at home is almost impossible, right? I mean, I know that as a parent. So you do have to give some amount of break to parents that they can't do it all the time. And they're with their child really 24/7 while we're with them for an hour or two a week. So all we can do is talk to them about that, about the importance of the consistency.
Sometimes we find it as the biggest gap, the real gap that has been filled in,
Yeah.
so that the child will, what to say, benefit.
Right. And so what I tell my students too is that we can do what we can do in clinic or in the classroom or whatever, and that can make a change. The child can behave in one way in the clinic or in the classroom, and that still benefits them. They're still learning. We can do as much as we can to help the parents, support the parents to have it carry over into the home. But yeah, it's hard. Yeah. Okay, I think I better say thank you very much for your attention and your questions, your amazing questions. I really appreciated being invited here and seeing you all, meeting you all. Thanks.
Good morning. I've been given the duty of the vote of thanks. So I hope the session has been very fruitful session for all of you, because you have got a hold of ABCs of the positive behavior support. I'm sure that you have gained a lot of knowledge in that. And we are indeed very privileged to have Dr. Therese with us, because she's one of the person who can actually deliver the best knowledge to us. And also we are very thankful for sharing your interesting, your kind of interest into this particular field, and how you actually perceive the kind of positive behavior support and how to deal with the patients. And I would also like to extend my thanks to Dr. Sujaki Kunnar. She's not here right now, but she's been a continuous support to conduct such learning platforms, so that the professionals from in and around Trivandrum and also the students will get an opportunity to, share their thoughts, and also get a lot of information, and also to hear from the expertise. And I would also like to extend my thanks to all the technical staffs and the supporting staffs who've been very much behind this particular program to make it a big success. And also my sincere thanks to my colleagues and my friends, because I was not here last day, and they've been running behind to make it there shouldn't be any gap. So they've been running for all those things. So thank you so much, guys. And also, I would like to extend my sincere thanks to all the participants and the whole team, so that you've been very proactive, and you've been very interactive in asking questions and all those things to make the program a real success. So thank you all. And with that note, I would like to request Ms. Shirley Jacob. She's the head of new initiative, to hand over the memento to Dr. Therese.
Thank you. That's beautiful. Thank you. Oh, really? Yeah. Wow. Oh, my dress. It's okay. Thank you very much. Thank you. It's beautiful. You guys are talented.